Initiating. Beam me up, Scotty. So let's get the party started. Hello, planet Earth, and welcome to Facial Team's live channel. And thank you for joining us. I'm Lilia, and my pronouns are she and hers and they. And I'm here to bring topics that matter to the trans and gender diverse community to the table. So today, I'm fortunate to speak with top surgeon, ethicist, and active trans ally, Dr. Ioannis Ntanos. Welcome.
Hello, everyone. Nice to see you, Lilia. Thank you for inviting me. And thank you for pronouncing my difficult to do surname correctly. Thank you.
I've got the phonetic spelling here, so that's helping. So viewers, thanks again for listening, and tell us, please, if you have any questions along the way in the chat, any of your comments regarding healthcare ethics, so we can include them in our discussion today. So, Dr. Danos, please, could you tell us a little bit about yourself before we get going?
Yes, so if I have to describe myself from a professional perspective, I'm a dedicated surgeon focusing on top surgery for gender diverse individuals. I live in the UK since 2013, but my background comes from general surgery, breast surgery, and then since 2017 exclusively on top surgery. I also have a degree in the medical ethics and the law, and last year I completed my MBA studies too. So my background is a bit diverse, but my main focus of what I do is focusing on delivering high quality healthcare to trans and gender diverse individuals. I like poetry and the color green.
Oh, green is one of my favorite colors too. Well, it's great to hear that you have been continuing your education throughout your career, which has taken you from Greece to Romania, Paris, and now in the UK.
Mm-hmm.
I just want to mention you in 2019, you were named Doctor of the Year. Where was that exactly?
Well, that was when I was working in the NHS in North Manchester. It was a huge honor for me to be recognized by my colleagues. And I was also chairing the clinical ethics committee in that hospital for a couple of years. I have quit my NHS job in last September, and I'm now focusing on my private practice.
Okay, so you're a WPATH professional, and you're also a member of the British Association of Gender Identity Specialists. Can you tell us a little bit about this association?
Yeah, so the BAGIS, the BAGIS, is an association of professionals who deal with gender identity from different fields, though. So it includes surgeons, it includes psychologists, psychotherapists, counselors, GPs, and we come together once or twice a year and we discuss our challenges and aspirations, trying to create a network of similar-minded professionals to support each other and our patients. The next conference is in October in Cardiff. For anyone interested, you can just look on the association's website.
Okay, I put the name of the association in the chat if anybody's interested in looking into it.
Brilliant.
BAGIS. And you're also a member of the Academy of Medical Educators and the Institute of Medical Ethics. So...
Yes, the Academy of Medical Educators, I've been a member for many years because I'm a very fond of education. I always had and still have, even in the private sector, students come to observe my practice. The Institute of Medical Ethics is one of my passions since I was a medical student. So once I got the chance to get on board on it, I did. And you mentioned WPATH earlier. I'm waiting for my exams this year to get accredited from WPATH as well. So I have followed their accreditation system for the last 2 years. Hopefully it will be concluded this summer.
Fantastic. And on the topic of education, you've also put pen to paper no? And have developed the first chapter of a reference book on breast surgery?
Yes, this has been a great honor to be invited to participate with a chapter on gender affirming topsurgery on the companion from breast surgery. It's in 7th edition right now. It should be published somewhere between June and October this year. And I grasped the offer straight away because I believe that topsurgery should not be on the fringe of breast surgery, but be included as a separate important chapter, and that most breast surgeons in the UK or in the world should at least expose themselves to this line of work. On whether we'll be eager to take it on board full-time is a different discussion, but they should be aware that it exists and what particularities it might entail.
Very well said, Dr. Danos, because it rings a bell for us too here at Facial Team, because facial gender surgery is a branch of maxillofacial craniofacial surgery. So yes, our doctors are frequently visiting different professional conferences and bringing to light to facial gender surgery as a part of the discipline. And also I should mention as one of the key surgical elements in gender transition. So previously in the WPATH's best practices, now FFS is a considerable section on the topic of facial feminization, but formerly there was really nothing in there about this. So it's starting to become more diverse as well.
There is a lot of information on the standards of care from WPATH regarding topsurgery, and by pretty renowned surgeons, written by pretty renowned surgeons too. The issue is on whether someone who is going through training to become a breast surgeon, for example, is exposed to this line of work, either in theory by reading a companion in surgery and a companion handbook, or in practice, if they are lucky enough to end up in a unit that offers this type of procedures. So raising the profile of gender affirming surgery is hugely important.
Absolutely, and I can complement, I'm sure, the know-how of professionals, because facial feminization surgery or facial gender affirming surgery does, like you said, have particularities which are not maybe so common in surgery for the general public, but could be an element that adds to the whole array of techniques that are available to all people of all genders.
Absolutely.
So before we get any further, let's do a little privilege disclosure here.
Yes. So I think we should always include in all discussions the members of the community we serve, and if we're coming to a privilege disclosure, I'm a cis hetero white male consultant surgeon. It doesn't get much privilege, more privilege than that. Okay, my efforts are not only to improve healthcare for the people who seek the services I provide, but also to raise the profile of what I do in the surgical community in general. Because trans healthcare is not some legendary mythical creature hidden in a cave somewhere. It's everywhere, and we should be confident to deal with our patients in healthcare in general. We shouldn't just keep it aside for some, I don't know, particular individuals who were lucky enough to be involved in this line of work. It should be opened to everyone. So yes, I'm privileged. I'm working every day to recognize and see how my privileges affect anyone else. We are here to serve others. This is the definition of the medical profession.
Absolutely. And I'll also say I'm a cis presenting female, but do not believe in the gender binary. So I use pronouns they as well. And also recognize the intersection of privilege that I may access as a white person. So yeah, that's important. Like Dr. Danos has said, we do always want to bring trans, non-binary, gender non-conforming voices to the table whenever we can. But today the platform is to hear from Dr. Danos as a medical professional in top surgery, who is invested in providing the best possible service to the trans community. So talking about being a provider, what ethics are important for gender surgeons, Dr. Danos?
Oh, okay, that's a big question.
Yeah.
So let me start by saying something on why I got hooked up with ethics in the first place. Because I got my master's degree back in 2000, I graduated back in 2011, so it's been 12 years now. And I strongly believe the fact that I was immediately drawn into gender affirming care was because of that master's degree in ethics. Because in ethics, you develop the ability to take in consideration counter arguments, to open your mind, to realize that not all questions can be answered by a single yes or no, that not everything in life is black or white. So you start as a foundation that life is non-binary. It's not yes or no, it's not hell or heaven, it's not black or white. And then you start building on this, having in the back of your mind always the someone's best interests, their autonomy, and you move on from there. So I believe that first of all, ethics is important for any medic. Then, having realized the excess privilege that surgeons have throughout the entire world, because I've practiced surgery in 4 different countries, and surgeons do tend to have certain characteristics in between them. It's more important for surgeons to expose themselves to what ethics means. And if we take that even further to the gender affirming surgery, I find it extremely difficult for someone to be really involved in the service without having at least the key ideas of consent, of autonomy, of best interests, of individualized care, of patient-centered care. And this all ties well with bioethics.
Okay, wow, it's quite complicated, as you say. And does the Hippocratic Oath come into ethics?
Well, the Hippocratic Oath is a very interesting condition. Not all medical schools actually swear to the Hippocratic Oath when they get their medical degrees. I did, where I graduated in Romania back in 2002. And I know that my colleagues in Greece do as well. That's not the case in the UK. The Hippocratic Oath is very important, but it's not ideal. It was written more than 2,000 years ago. So, and society does change, and we should adapt to it. But there are elements there that are important, and they did form the base of the booming of the bioethics in the 70s. So read the Hippocratic Oath, but reflect on it. Actually, you should reflect to anything you read in the first place. So there is no panacea, no perfect oath or no perfect grounds on where to rely to get your guidance about what you do.
Absolutely. So in a nutshell, we need to question the rules, and healthcare providers should be accepting, no, of all healthcare seeking people, regardless of their
well,
identity.
yes, I mean, to be able to accept, you have to question first. If you go in life thinking that your way is the only way, and that's it, and it's not negotiable, there is no way you will leave space for someone else to express their views, their feelings, and try to meet somewhere in the midline. So there is nothing that is set in stone. I mean, in surgery, if we look on what surgery was doing, I don't know, 300 years ago, from a technical point of view, it feels like torturing. However, even then, there was a single reasoning for it, and it was trying to help. And if we keep that in mind, that we should be trying to help and balancing whatever we do on whether it helps others, then I think we would be in the right track.
Absolutely. And then that sort of point of view is what led to the rigorous scientific inquiry, which is what underlies all investigation and research, supposedly.
Supposedly.
So are ethics taught to med students?
Yes and no. I think it's not taught enough. Although there are different curricula in different medical schools, I think right now most interest will have to come from the individual. I don't think that the medical schools are investing enough in opening someone's mind by presenting them an opportunity to be involved in bioethics. But this is not necessarily a conscious decision, because from when I was studying medicine back in 1996 or 2000, medicine has boomed. Things that we used to study and we would say, well, we don't know, now we know. It's a huge volume of knowledge that you need to focus to study hours after hours and night after night. And bioethics is kind of the sideline, like an optional subject that you may pick up and you may not. This is why, on top of medical school, bioethics should be part of everyday practice. So when we discuss with our trainees or our students while doing clinical work, we should always try to give that perspective as well. That, there is an ethical element there. You might want to think about that. You might think about your privilege, the way we expressed it in the beginning of our discussion today. And this is part of our responsibility as senior medical providers.
I would go even further and say that ethics would be interesting to involve in a lot of different fields where you are caring, not just caring in the medical sense, but are responsible for providing any kind of customer service to different people. I mean, just, the people on the phone at the other end of the line of the customer service, there has to be some kind of ethical background there, no? I would say.
Lilia, you're absolutely right.
Let's put all the politicians in an ethics class.
You're absolutely right. To me, someone who is dealing with a medical record, a porter, whose job is to take the medical record from one building and transfer it to the other building, should be aware of the implications of what they are doing. And how important that job is, and what's the effect on other people. It's not just a job. Okay, it might affect directly, and I'm pretty sure that once you give everyone the opportunity to speak up, to be exposed to that line of thinking, they will pick it up.
Totally. Yeah, and it's many times it's the little things in our day-to-day interactions that make the difference, don't they, and add up and leave people with a negative feeling, where if there were a little bit of ethics training, then perhaps that would be different. So, Dr. Danos, you said something very interesting when we were speaking the other day, preparing for today. And I think it's probably one of the questions that I'm most curious to hear your answer about. It's, are health providers unethical beings?
I'll start by asking something else myself.
Okay.
Is being a medical provider puts you on a kind of pedestal? Okay, are we different than other beings? I think being ethical or unethical has nothing to do with your profession. We tend to think that healthcare providers are better equipped, and in their foundation they care about other people, and most of them do. But being ethical or unethical is a huge discussion to answer, because it has grounds on our personal views. I have been asked if I'm unethical. I have been asked if I'm a pervert for doing the operations that I'm doing. And I don't think that someone changes their ways of thinking and their character once they change the line of work. I cannot believe that I was ethical while I was doing breast cancer work until 2017, and then switched to a non-ethical work when I decided to focus on gender-affirming care. So no one is ethical or unethical de facto per se. We are our decisions and our actions. So I don't think that people involved in gender-affirming care are unethical in any way, because we know that gender-affirming care works. We know that it improves the livelihoods of others, and that's the most important thing in medicine. This is why I became a doctor in the first place. This is the romantic view of medicine. We expect that most of the people who go into medicine are there to help others. And this is what gender-affirming care does. It helps others.
Absolutely. And I would say that what your explanations, the explanation you just gave, is also a very good answer to, is trans healthcare experimental? Because that's something that is a lot of trans healthcare providers are being accused of being experimental.
Well, if you look to any timeline of medical breakthroughs or medical discoveries, gender-affirming care precedes a lot of other things that we never question as experimental. It's been around for longer. It's been tested. We know it works. So the debate on whether it's experimental or not doesn't have any foundation.
Absolutely. Totally agree with you. So do you think that we need to continue to say this, stand up for the minority group, that the healthcare providers are providing the services to a minority group, and have, I, for example, find myself in a situation where I just want to be like, on Twitter, say what I think, but so it's not always easy to do this, from a business perspective. Do you think that it's important for individual healthcare providers and businesses to start standing up and having a voice as trans allies?
It's massively important. It's important to give voice. If anyone recognizes their own privileges, it's important to give voice to those who don't have them. So that's the baseline. We don't speak enough, and we don't speak in the correct channels. And sorry for saying so, Lilia. I mean, Twitter it's not the right channel to say anything nowadays. It's very ill-intended by different people. We should be trying to bring the conversation every chance we have. I am notoriously boring when I attend parties or gatherings, because that's the only thing I want to talk about. Okay, I want to talk about gender-affirming care, about how it affects everything else, about how trying to marginalize a certain group of people has been shown in history to have certain results that we should never have again. We should speak up every chance we get. For example, we should speak up when someone, I speak up when someone misgenders my patient, even if they are induced and they are unconscious in the operating table. I speak up when it happens and when that person is not around. I speak up whenever I can where, however, I think that someone will listen. Trying to take out all your frustrations and efforts on Twitter will just get you exhausted.
Absolutely.
This is what we do right now, aren't we?
I just want everybody here listening, please cheer for Dr. Danos right now. He's a model for other healthcare providers, and everything you just said just encapsulated it perfectly.
Thank you, Lilia.
I agree with you that, yeah, I'm also one of those boring people in the party. Well, maybe not so boring, because oftentimes when people find out what field I work in, when I decide to disclose this, and because I feel I'm in a safe situation, and I become like the focal point, like I'm put on a stage and everybody's boom, boom, questions and questions and questions. And it's complicated because sometimes it leads to debates about, you know, everything LGBT, and it can be tricky. Yeah. But I'm there fighting the good fight.
I adapt my way of trying to be a vocal ally dependent on where I am. For example, if someone asks me, why do you have your pronouns on your email signature? Most of the times nowadays, I will say it's very easy to find. If you can Google, I don't know, when was the last massive concert of, I don't know which band, then you can find out what the pronouns are about. So I will not waste time for that. But if something more important comes out, for example, someone questioning, why are we doing gender affirming care when we don't have enough money for, I don't know, cancer care? So then you touch to the allocation resources debate, and then we can discuss it, and I can tell you my opinion. But if something is so easily found with minimum search online, just educate yourself. Don't expect others to do it for you. Especially don't expect the community to do it for you.
Very good point, because it's exhausting. I've heard so many times, you know, just tired of the classic questions, you know, which can be very invasive and not very respectful of one's privacy. So yeah, think twice, and Google is an amazing resource. And also there's plenty of associations and groups and organizations that's what they do. And their websites are full of information, and they organize events that you can attend to get to know the different people in the LGBTIQ community.
Definitely, but that means that you are genuinely interested. Because if you are only interested for some chit chat during someone's birthday, well, I'll prefer the cake.
Exactly. So let's talk about medical tourism, Dr. Danos. What do you think about the ethics of this?
Well, medical tourism is a reality, and it's very easy for someone, because of the internet, to find another provider in another country and fly there, have their operation, go back to their homeland. There are voices from official lips, from the College of Surgeons, for example, suggesting that this should be avoided because of the aftercare, because of the credentials, of the quality, because you don't know about the regulations in the country where you're flying into. However, there are restrictions in certain countries that force people to go abroad to have their operation done, which is one thing. And secondly, there are also financial restrictions. Some countries are cheaper than others. And I would never say, having worked in 4 different countries, I would never say that the surgeons in that country are better than the next one. I mean, skills are roughly the same everywhere. It's about the individual that you choose to go with. So in that sense, we should first examine why certain operations are allowed to be performed in a country and not in another one. Secondly, we should explore why some people would go abroad just because of the waiting times being shorter than waiting to have their operation in their own homeland. And then it's the financial issue as well. So what people should know is that this is a reality, that credentials are important. I don't expect me, for example, to operate differently if I'm doing the operation in the UK or in Athens or in Malaga or I don't know where. Okay, but there are individuals who you need to research first before going to have an operation with them. I find it extremely strange that at least, I mean, the UK is not in the European Union anymore since the Brexit referendum, but I find it peculiar that in the EU, there are different laws and different things that are allowed to be performed in different countries. There is no uniformity on what we accept as gender affirming care, for example, that can be provided. Because I did have patients from other countries in the continental Europe that have flown to Manchester where I work, and they had their operation here because the operation was not permitted in their country. It was because for certain legality reasons, it wasn't allowed to be performed. It's something for the politicians to consider.
Absolutely. There is quite the uproar right now about healthcare access in the United States and in the UK. And we know that countries like Hungary and Poland are very staunchly opposed to a series of gender affirming procedures and treatments. So yeah, this is something that perhaps WPATH and the European version EPATH and the Canadian version and the Australian version OSPATH and New Zealand version together will be able to continue to, you know, set the standard and have the defining voice, no, on the viability and the ethicality of trans healthcare. No?
I would love to see some uniformity, and I see it most of the times in the organizations you just mentioned, but this has to be translated to political action as well. Unfortunately, gender affirming care has been severely affected by certain policies. I mean, you see what's happening in the States, as you mentioned, different states from complete ban to be named refugee states. I mean, it's,
Yeah,
you can see that,
and criminalizing the providers.
it's, yeah, I mean, and it all comes down to a certain narrative about politics that we have seen growing up in the last years, and that's another reason why we have to be vocal about it. I believe that the restrictions that some are trying to impose on gender affirming care is just a testing ground for restrictions elsewhere as well.
Yeah, absolutely. It's sort of a bridge, isn't it? And some of the activists, the trans activists, warned that this kind of legislation against trans healthcare was going to be a bridge to removing control over women's rights, and it's happened already.
Yes, yeah,
in the
yes,
term of
because
abortion.
at the end, sorry, because at the end of the day, what we are restricting is essential care to someone who needs it. And I cannot see myself any justification for that.
None whatsoever. I agree with you completely. And I just like to comment now, you were talking about, you know, in terms of medical tourism in the different countries, we've got people listening from Australia, from the USA, the southern part of USA.
That's wonderful.
And Pakistan. Few people have made some positive comments here that are watching now. So, Dr. Danos, moving on from the more ethical part of our conversation, you are a chest surgeon. So can you tell us a little bit about the gender affirming BAs that you perform?
So I don't regularly perform BAs. I perform mastectomies.
Okay.
So I'm doing chest masculinizing surgery for trans masculine individuals, or offering top surgery for non-binary individuals. That's my main focus. Although BAs for trans feminine individuals is something that is on my arsenal, which I don't regularly do.
Okay.
Mainly because BAs can be offered by all of plastic surgeons who offered BAs to cis females too.
Of course.
So there are key differences, however, on a mastectomy which is performed for a breast cancer, and the mastectomy that is performed for a gender diverse individual, because the aesthetic elements are different, because the expectations are different, and because in the first case you are treating a cancer, and this should kind of cover everything else. You're trying to remove the cancer and offer a good survival percentage to the patient. On the other hand, you're doing an operation to improve someone's life, to change their life, to help them achieve what their body should be in the first place. So there are things there to consider as far as the surgical technique is concerned. But secondly, you are dealing with a completely different cohort of patients. It's a different group. Cis women with breast cancer that have to have a mastectomy for their illness, and a different group, gender diverse individuals who need to have a mastectomy to be who they really are. They come from different backgrounds. They have completely different experience from healthcare. They have completely different expectations from their healthcare providers. And on one hand, for example, in the UK, you get around 55,000 new diagnoses of breast cancer every year. So it's a huge number of voices that can dictate what they need and what they want. And on the other hand, you have a very small number of individuals having top surgery coming for certain backgrounds with not enough voice. We need to become their voice. So there are key elements for both, but there are huge differences too.
Absolutely. Yeah, there's big differences also in facial surgery. Like you have defined your niche in mastectomies for trans men and non-binary people, and facial team has specialized in facial gender affirming surgery or facial feminization surgery for trans women or trans non-binary people who desire more feminine appearance. Yes, there is some masculinization possibilities there. Yes, there are also cis people who want to access this surgery, and the techniques are similar, but as you said, there are some differences that are important to point out. So in terms of, sorry, you were going to say.
No, go ahead.
I was going to go on to the non-binary surgery. Do you think that we need to draw lines into categories for access?
There are lines already. For someone to access gender affirming care, they need to fulfill some criteria. Although I am a supporter of the informed consent model, and I don't entirely understand why someone doesn't need a referral to have, I don't know, a 700 grams of breast augmentation, a cis woman, for example, but someone who needs top surgery does. I understand why a certain pathway and some restrictions should be there to protect the patients. So I understand why Sometimes there is an association with some mental health issues, and this should be addressed, but they should be addressed in any type of surgery. I would expect that if a surgeon who is about to perform a breast augmentation in a cis woman sees elements or is willing to see elements of mental health issues in that patient, that he would explore them and not just go ahead and do the breast augmentation straight away. So I think the restrictions should be similar, should be proportionate. We shouldn't be restricting access to gender affirming care in a way because we feel that gender diverse individuals are a certain group.
Absolutely.
They are like everyone else, trying to live their lives in a meaningful way, trying to move on with their lives, and this is what we should be aiming to do. Offer them the level of care they need.
With as little gatekeeping as possible, and yeah, normalizing their healthcare as well. And the women who want to have, you know, giant breast implants are able to do that, and they don't need to have a mental health report for this. They just have to find the surgeon that is willing to do it and pay the money.
Well, you're touching in too many things. I mean, financing, yes, I mean, that's important. And there are surgeons in the private sector. We make money from what we do. Okay. What we are discussing is why do we keep certain cohort of patients differently on some assumption that there is something fundamentally wrong with someone else? There isn't.
Right, exactly. And that has been officially warranted by the World Health Organization, as well as the American Psychology
Medical
Association.
Yes.
And they've all stated that being transgender is not a pathology, right? And so, and we were talking about non-binary aesthetics, no?
Yes, so non-binary individuals are lovely and very interesting. And they are very interesting because they tend to dictate themselves what their aesthetics are, which is brilliant, because we said about our privileges and our backgrounds, and we said about binary, and not everyone will fall in these two extremes. Actually, most of us are somewhere in between, and we should be allowed to find our place somewhere in between. We shouldn't be forced to go in either of the two ends. So non-binary individuals that come to me, for example, for top surgery, are asked, how do you want your chest to look? And what are your aesthetics? And they should be allowed the freedom to dictate how their chest would be. For example, after a bilateral mastectomy, they might choose a no-nipple reconstruction, which might sound very awkward to someone that has never seen this line of work. So I have seen patients coming to me after their initial choice as a surgeon declined to do a no-nipple reconstruction, and they came to me because that is possible. And I don't think they were really intended. I just think they would never imagine that this is a possibility, that this is something that people want and go ahead with. So it's very important to allow individuals to speak up, to explain what they need, to explain what they want, and then, of course, you will have the time to explore with them why they want something. Because I have discussed with individuals that came to me, for example, they said, I don't want any nipples. And they didn't want any nipples because of a horrible story that they heard from someone else that had a failed nipple graft, for example, and that was not a rational fear, and we addressed that. But if this is who you are, this is what you want to do, why question that? Let's go and do it.
Of course, yeah. And it's like you said, it's important for the surgeon to ask these questions, to have that conversation with the person in order to get to the real reason behind each and every aspect, of the result.
But that means, Lilia, that first of all, you do some research yourself as a surgeon. You know what people might ask for. You know that your own aesthetics don't necessarily translate to someone else's aesthetics too, or your expectations about how someone's body should look. We are here to serve and not to be served. That's the easiest way I can put it.
Right. Yes. It's a lot of practice in active listening, isn't it? And active, yeah.
It's very rewarding once you get there. Very rewarding. It's a much more rewarding process to have an interaction with your patient and get to a common ground, then stand your ground and say, this is who I am, this is what I do, take it or leave it.
Yeah. And also it's hard work too, because it requires the individual, the medical professional, to go inside their own minds and learn more about themselves and realize they have certain standards and certain ideologies and certain ideas that other people might not share. So
you are correct, but this is why this process of self-reflection should start much earlier. Should start from high school, from medical school, from training. This is why these ideas of a spectrum, these ideas of listening, these ideas should be available to the medics from the beginning. Because if you try to do it to a professor of surgery for the last 40 years, it will be extremely difficult.
oh yes, absolutely. And it goes beyond emotional intelligence too, doesn't it?
Hopefully.
Is nowadays in most dynamic and progressive workplaces, they want the team members to have a certain level of emotional intelligence. So that's very important for the new and upcoming surgeons and other medical practitioners to keep in mind.
I totally agree, but I cannot forget that medicine is a very paternalistic science, and it will take much greater effort to implement emotional intelligence than to other sectors, for example, business or teaching.
I'm talking about teaching, and you have a masterclass coming up.
Oh, yeah. Yes, this has been a plan for me for quite some time. So I do have a master class on topsurgery. Topsurgery is a term that includes both masculinizing topsurgery and topsurgery for non-binary individuals. And it's coming up on the 26th of May. It's CPD certified and it will be provided entirely online. So yeah, I mean, if everyone is interested in joining me, you can find more information on either on my website or the banner you're just showing. Thank you very much, Lilia.
Yes, I've just shared the link in the chat, and there's the banner. You can check Dr. Danos's website.
So the master class is not. It will the morning of the master class will be focusing on surgical technique, tips, tricks, things I have been learning through the years. But also we'll have sessions with the members of the community, with patients that had top surgery themselves, with patients that will discuss in between them what were their limitations and what were their aspirations to have top surgery. There is also a session about ethics that we will be discussing with the professor of law and ethics from the University of Manchester. So yeah, I would like to see you there.
Yes, fantastic. So good luck with that, and I hope you have lots of people coming. Please do let us know if you have questions, and I'll be sure to direct you to Dr. Danos if you're interested in the workshop, in the masterclass. So do you consider being an LGBT friendly doctor as an advantage when you receive trans and non-binary clients over general practitioners?
Definitely. First of all, it being an ally, being LGBTQI plus friendly, increases your reach out to the community. I have recently had queries from cis women who want to have a breast reduction, for example, but they want their surgeon to be LGBTQ friendly. So although I don't advertise those type of surgeries in my website, because they find me trying to find a surgeon who is friendly, they asked if I'm happy to perform their operations. So being friendly will have an impact on your business to begin with, but it will make you a better surgeon. It will probably make you a better person too. Being open to diversity, to something different, to something that maybe you don't entirely understand, but you are willing to, I think is essential if you are involved in healthcare.
Absolutely. I think that kind of goes back to us talking about emotional intelligence and other kinds of intelligences, right? It's just about having that friendly bedside manner that when anyone wants to do something which is quite intimate, related to their breast, for example, and really looking for a person that they're going to feel comfortable with.
Keep in mind, Lilia, that exposing yourself to this line of work and trying to educate yourself, if you are in healthcare, it will be important even if you are not involved in gender affirming care, because gender diverse individuals do have health issues outside gender affirming care. It will be much easier to deal with a fractured forearm in a non-binary individual if you know what a non-binary individual is, and not just, I'm just an orthopedic, I'll push the cast on and you can go. So exposing yourself and educating yourself, indifferent on whether you are directly involved in this care, will have an important impact on your patients.
Absolutely. So that is one thing that trans healthcare can teach healthcare providers in general. Are there any other points that you think that trans healthcare is leading or could be leading the way for healthcare in general?
Yes. So yeah, being open is one thing. Accepting the need for continuous education is another thing. You just don't learn something in your first year of training 20 years ago and just carry on with the same thing forever. So the constant adaptation, the constant learning is another thing too. The fact that gender affirming care is in its essence patient-centered should be a paradigm for healthcare. The fact, for example, that we spent as surgeons, at least the surgeons I know, at least an hour discussing with our patients when we discuss top surgery, for example, should be an example on how you go through the consenting process in any other operation. For example, I do have a general surgical background, and I'm certain that if I was to consent someone today for an inguinal hernia repair, it will be much more extended, much more detailed, much more focused on the individual than how it was back in 2010 when I was doing this operation as a senior registrar. So I think that being involved in gender health, in gender affirming care, had made me a better surgeon.
Fantastic. Well, that's a call for all of our healthcare providers at large to join us in trans healthcare.
Yes, all of us, all of you.
So just to close, Dr. Danos, do you have any tips or suggestions for people who are considering top surgery, how they should prepare for a consultation with you?
Well, I have included a lot of things on my website, okay, at ioannisntanos.com. So it's easy to go there and find. What I suggest to everyone who is asking me this question is do your research. First of all, do your research. not only on what is available, but on the individuals who are providing to. And secondly, don't be afraid to speak up. If someone is involved in gender health, in gender affirming care, should be open to whatever you have to say. If it differs, and if it is about your background, your medical history, your aspirations, your expectations, speak up. Because I know that you might have experienced some gatekeeping, some bad experience from healthcare in the past. This is not the case when you're looking on gender affirming care. There are some wonderful individuals around. Find them and speak up to them.
Absolutely. And we say that a lot as well, although we understand that sometimes it's not easy for patients to do so because they inevitably feel, you know, that power play, which is hard to avoid. But yes, I completely agree. I think that's excellent advice. And in general, I think trans people are accustomed, aren't they, to having to fight their way through, you know, and educate their own healthcare providers on their own, on trans healthcare in general. So yeah, but when you are dealing with someone who is saying they are a trans healthcare professional, then it should make things a lot easier.
It should. And this is why you need to do your research.
Exactly.
Yeah.
Thank you so much, Dr. Danos, for your time, for your knowledge, for sharing everything here with us today. Yeah. It's
been a pleasure, Lilia. Thank you very much for inviting me. Hopefully we'll meet again soon.
Yes, I hope so. Very soon. Well, thank you everybody for coming, and please let us know in the chat what you think of our live stream. Like, follow, share with your lovely friends, and remember, as Dr. Danos said, your health and happiness matter. Until next time, bye-bye.